Second topic, it has to do with big pharma. And it irks me that this doesn't get more play. The title of the title of this particular piece that that I drug out of Common Dreams last night was "No Surprise, Big Pharma Sues Biden Over Effort to Lower Drug Prices for Americans." And if you notice, remember last week I spoke about Merck and Merck suing the government. Well, that was not enough. That wasn't enough. They want to cripple the ability of your government, our government. They want to cripple it before it gets started because they are scared about that stone rolling down the hill, that little snowball rolling down the hill and becoming pretty big, right? So it's no surprise that Big Pharma sues them. Here it goes. It says, aiming to protect wealthy pharmaceutical companies from any reduction in their tens of billions of dollars in annual profits or lavish CEO compensation packages, the industry's biggest lobbying group on Wednesday announced a lawsuit against the Biden administration over its policy allowing Medicare to negotiate lower drug prices for consumers. Part of the Inflation Reduction Act that was passed last year, the Medicare negotiation provision has been a key demand of progressives, including Senator Bernie Sanders, for several years, as the United States pays more per person for prescribed drugs than any other country, and nearly a third of Americans said in one survey last year that they have avoided taking medications due to costs. So if folks are taking medication, not taking their medication due to cost, that means that a certain percentage of those folks will get sicker and yet another percentage of those will die. So therefore, I think there's a direct correlation between the pharmaceutical companies and unnecessary illness and unnecessary debts. Before I proceed with the article, ask yourself a question. They are suing the United States government for wanting to negotiate prices for drugs. Maybe it is time for us to have a class action lawsuit against the drug industry, against pharmaceutical companies, under the premise that they are effecting the illnesses and murder of our citizens by their policies. I am in several organizations, other organizations, and, every so often these organizations get sued, right? These benevolent organizations, these nonprofit, people have disagreements and they decide to sue each other or whatever. And I always say, for the one who knows that they're in the right, it is time to be aggressive. And aggressive means immediately counter suing when you have things like this. I think we could create good grounds for suing a company who has developed products based on money you, the taxpayer, has paid to universities and the NIH and other departments to develop these drugs. And after these drugs are developed, these companies try to charge you again exorbitant amounts to use these drugs. And because we, the people who've already paid for these drugs, can't afford it, we get sick. Some of us die. I think it is time for us to sue those companies civilly and criminally. I mean, if we know death could occur, we could probably find a good lawyer who could say that is premeditated murder. Wishful thinking on my part, but you know what? Aggressive thinking, it's what we are going to need if we are going to bring some benevolency back into this society. But we can take that another time. Back to the article, although a Congressional Budget Office analysis found last year that allowing Medicare to negotiate lower drug prices would save the U.S. nearly $290 billion in new revenue and savings over a decade, the Pharmaceutical Research and Manufacturers of America on Wednesday became the latest pro-industry group to sue over the provision, arguing the law is unconstitutional. Wow. It's unconstitutional. I want people to understand what this is saying here. They are saying it is unconstitutional for our government, we the people. It's unconstitutional, they're claiming, to negotiate for better prices for all of us who are paying the bill for these drugs, but not only that are paying the bill, that wants to pay the bill to get these drugs, but also paid the bill to develop these drugs. They're suing us. I mean, you know, I know a lot of you have heard the frog story. The frog story is that if you put a frog in water and you put some heat into that water, and you gradually heat that water, as that water is heated, because the change in temperature over time is so small, by the time that water starts to boil, that frog is so used to it that it dies being boiled, because again, the delta change was so little that it was imperceptible. Is that a true story, or is that truly how it works? Look, when I get into the shower and as I progressively get the water, eventually it reaches the point that you want to. But again, you get the gist. The gist is that these guys have been doing delta wrongs for so long. In other words, I get a little bit worse every year. We push it to the limit every time, a little bit more. So much so that when we are at a maximal level of evil, like these drug companies are right now, when you reach that maximal level of evil, to you it doesn't even seem all that evil. That you are suing a government trying to make drugs affordable to people so that they don't die. Ultimately, that's what it is. So that they don't die, they're putting these products out. They're trying to negotiate the price of these products, of which these guys are saying, no, it is unconstitutional. And you mean this didn't make big news yesterday or the day before, etc., on our news channels? It didn't make that. It's amazing. But anyhow, here's the deal. Continuing with the article, because just reading it is frustrating. But Pharma argued in a court filing in the Western District of Texas. I noticed where they wanted to file that case, right? In the Western District of Texas, that the provision violates the constitutional requirement for checks and balances by placing too much authority in the hands of the U.S. Department of Health and Human Services, the due process clause by denying drug companies input regarding pricing, and the Eighth Amendment ban on excessive fines due to the excise tax big pharma companies will be required to pay if they refuse to negotiate. All right. So the Biden administration is saying negotiate for the prices, and if you don't negotiate for these prices, there'll be an excise tax, right? And why an excise tax? Well, of course there's an excise tax. I mean, we paid for these drugs. We paid to develop these drugs. So, you don't negotiate, again, we have the right to tax. So they're saying, no. We want the drug companies. While you are negotiating prices, we want to have input in what those pricing conditions are going to be. Okay, really? I mean, the idea that they are serious about this makes one wonder. Again, like I said, the frog metaphor. Holy City says you completely destroyed the boiling a frog metaphor. I don't know that I did. Maybe my words didn't come out as clean as they should, but the idea is a delta temperature is what makes the frog boil. I mean, it's staying there to the boiling point, my friend. So I think that is accurate. All right. The Senate Finance Committee Chairman Ron Wyden said it was no surprise that pharmaceutical companies want to stop the Medicare from saving millions of senior citizens out-of-pocket costs and warned that they'll likely be successful if a Republican candidate wins the presidency in 2024. I expect the Biden administration to vigorously defend Medicare's bargaining power so seniors will see the lower drug prices they expect, said Wyden. This legal action underscores how critical it is to have a president in the White House who will fight for lower health costs for Americans. I have deep concerns that a Republican administration would roll out the red carpet for Big Pharma and once again ban Medicare from negotiating lower drug prices. Lower drug prices. Pharma was joined by the National Infusion Center Association and the Global Colon Cancer Association in legal challenge, which follows a lawsuit filed by drug maker Merck, right? Earlier this month, which is the one that we spoke about a few weeks ago or a week ago. The U.S. Chamber of Commerce and Bristol Myers Squibb have also sued over the provision this month, with the latter claiming, as Pharma did Wednesday, that the law is bad for innovation. All right. The law is bad for innovation. I'm glad that they said that. Now the lawyers for the government can really go into where innovation actually comes from. When they say it's bad for innovation, what they're saying, brothers and sisters, is the following. If we are not allowed to charge you exorbitant prices for the drugs that we sell, we will not have innovation because we need all those profits to innovate. It amused me also that a part of that consortium suing the government is the Global Colon Cancer Association. Because anybody who watches TV every single day, whether it be the broadcast or cable news, etc., you know there's this new colon this new colon test on the market. You can go ahead and without a colonoscopy now you can actually determine if you have colon cancer by simply doing this in-home test, right? And every half hour or so, I'm not going to name the drug, I'm not going to name the test or anything here, but every few minutes in between the breaks, you hear this colon advertising come on. Where the hell is all that money to keep advertising a test? If you go to your doctor should tell you, hey, you need this test, you need that test. You don't need for the monies that we are going to pay for these tests and these drugs to be advertised on TV ad nauseum. We don't need to have these advertising over and over again because that is money that's you're paying for. Every single ad that you see on TV for medicine, every single ad on TV that you see for a test, when you hear them say, go ask your doctor about this test, ask your doctor about this medication, those ads cost tens of thousands of dollars to put on ABC, CBS, MSNBC, and all of that. Every time they air, thousands of dollars to air that ad. And to pay for that ad, the expectation is more people are going to use that thing and they're going to charge you that amount of more money for the medicine, etc., as opposed to just letting the doctor know about the medicine and saying the doctor makes the best option for that. But now they want to use it as an excuse. Oh my God, it is going to somehow charge you. It is going to stop innovation if we do that, if we come and try to do that. So I want all of you to realize it's a sham. It is a complete sham. This drug issue, this drug suit that's going on right now, that they are going to sue you, or that they're going to sue, they're suing you. They're suing the government. We, the people, are getting sued by Big Pharma because they want to be able to exploit you. And when they talk about innovation, they need to make all this money so they can create newer drugs. They don't innovate. I repeat, I'm going to throw this back in a minute, but they don't innovate. The innovation comes, the genesis of innovation, the start of innovation in the pharmaceutical field starts at your university and from grants that the NIH, the government institution, give to companies. And the reason why is companies do not take risks. Companies do not take risks. So please, my brothers and my sisters, this is a big story, bigger than the media is talking about. And the media doesn't want to talk about it because they love those Merck commercials. They love those colonoscopy commercials, etc., that you are paying for with those high prices. They spend more money. They spend more money on advertising, executive pay, and shareholder dividends and value than they do on research and development. So that is a lie right within there. And I hope the Biden administration actually calls them out on that with the proof that's out there for all of us to see, that these drug companies spend their money on ads, spend their money on giving high salaries to executives, and spend their money on giving high returns to investors. Please, this is a huge story. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.